Well, the clock is ticking. Daylight saving time is right around the corner, as in this weekend. So on Sunday, we're going to be turning our clocks forward 1 hour. Technically, that means you're losing an hour of sleep. And we all know that sleep is important, but this time change on the horizon may want you to kind of maybe get in the habit of preparing now rather than later. So for today's To Your Well-Being, we're talking to Dr. Pallavi Reddy, a sleep specialist at Cone Health. For the next 50 minutes, she's going to be sharing what the doctor says makes for a good night's sleep. Not what everybody else says, what the doctor says. All right, so what can we do about daylight saving time and getting ourselves on track?
Hey Tanya, it's great to be here. Well, as a mom to 3 kids, 3 and under, this is my least favorite time of the year. To prepare for daylight savings and to make life easier, gradually shift your bedtime over a few days before the time changes. While adults adjust easier by losing an hour, kids do best when we nudge their schedules in baby steps. So
Gotcha.
every evening for 4 days before daylight savings time, shift dinner and bedtime 15 minutes earlier if in spring and later in fall.
Gotcha. And 15 minutes doesn't seem that bad. That's doable versus going to bed a whole hour ahead of time. All right, let's talk about why a good night's sleep is so important for just overall health. Some people say, well, you know what, I'll sleep when I'm dead. I love when people say that. And I'm like, yeah, you probably need that sleep.
Terrific question, Tanya. I always tell my patients good quality sleep is the foundation to good health. For children, poor quality sleep can impact their problem-solving skills, language development, and attention, all things that are important for school-age children. Good sleep is equally important as we age. Research has shown that sleeping less than 6 hours per night is linked to heart disease, stroke, mood disorders, memory loss, can affect job performance and interpersonal relationships. There is more awareness about the impact of sleep deprivation on our health, but many people actually aren't aware that sleeping too much is also harmful to health. So sleeping more than 9 hours is also linked to a variety of medical conditions.
Okay, so we need that sweet spot. We need that sweet spot of sleep, which is about how many hours?
7 to 8 hours.
7 to 8 hours. Okay, so let's talk about some common mistakes that maybe we're making that keep us up at night. What should we be doing versus what we are doing?
Well, I'm sure we've all been guilty of making some, or if not all of these mistakes. The most common one I hear is watching TV and using electronics in bed. I always advise my patients to take the TV out of the bedroom. It's good practice to reserve your bed for sleep only. Another common mistake is lying in bed for a prolonged period of time, trying to fall asleep or fall back to sleep. I recommend getting out of bed when you start feeling frustrated and getting in a dimly lit, cozy area and doing something relaxing instead of laying in bed and counting sheep.
Okay, all right, so actually get out of the bed. If you can't fall asleep or you woke up and you can't fall back to sleep, get out of the bed and read, but not on your phone.
Correct.
Okay, all right, let's talk about a healthy sleep routine. What does a healthy sleep routine look like?
Well, we know that children thrive on routines. This pertains to adults as well. So we need a consistent bedtime routine, which could be dinner, cleanup, and then wind down and relaxation time, usually 1 to 2 hours prior to bedtime. As I mentioned earlier, I recommend finding a cozy spot in your house, not the bed, and doing something relaxing and avoiding any electronics with blue light, since that can suppress your natural melatonin and make it harder to fall asleep.
Okay, so let's kind of go down the ages. You said you're a mom of 3, so for parents and caregivers of some like babies and young children, what should we be doing for them for sleep?
Great question. There's a lot going on in a baby's body and brain in the first few months. Their bodies are growing, their brains are growing, and routine is essential. Babies up to 3 to 4 months need 14 to 17 hours of sleep in a 24-hour period, including 2 to 3 naps. Babies like routines as well. The eat, play, sleep schedule is recommended. If you follow this pattern, you will have a great sleeper. When the baby wakes up, you feed them, and then you keep them up to play until they're drowsy. Once they're drowsy, you put them down, then repeat this pattern throughout the day. And consistency is key. Babies start to recognize a routine.
All right, how about those teenagers? It's kind of rough to make
Well,
them go to bed.
great question. In terms of bedtime routine, the same applies for teens. The American Academy of Sleep Medicine recommends that children aged 6 to 12 years should sleep 9 to 12 hours, and teenagers aged 13 to 18 should sleep 8 to 10 hours per night. The key difference with teens is that their natural sleep clock starts to shift back due to later melatonin release in their brain.
Okay, all right. All right, if someone has trouble falling asleep, daylight saving time or not, what should they be doing or not doing?
Well, the key is to listen to your body and get into bed when you start feeling drowsy. You want to associate your bed with sleep and keep a regular sleep schedule on most days. The goal is to fall asleep within 20 minutes. Try to avoid watching the clock and using electronics in bed. If you find yourself wide awake after a while, get out of bed and do the relaxing activity like we discussed earlier. And then just the act of getting out of bed helps to break the association between insomnia and your bed.
Yeah, because you just sit there and you stew about it. All right, let's talk about sleep meds and sleep aids. What should we be aware of when we're considering some kind of sleep aid?
Great question. Most sleep medications can be highly addictive and typically mask the underlying cause of insomnia, whether it's due to mood disorder like anxiety, depression, PTSD, and possibly sleep apnea. There is some utility in using sleep medication short term as an adjunct to cognitive behavioral therapy for insomnia or for someone who may be struggling with CPAP therapy for sleep apnea. Lots of people use sleep medication and are unaware of the long-term consequences, which can include memory loss and dementia down the road. But this is something that I like to educate my patients about.
All right, a lot of people don't think that melatonin is like a medicine. They see it as something that's natural. Is it okay for people to use melatonin?
So melatonin is actually a hormone that our brain produces in response to darkness. It helps with the timing of your circadian rhythm, which is your 24-hour sleep clock. And being exposed to light at night can block your melatonin production. Melatonin supplements may help with certain conditions like jet lag, delayed sleep phase disorder, some sleep disorders in children, and REM sleep behavior disorder.
Okay, so melatonin, you can give that to a kid.
Yep.
Okay, all right. So let's talk about this. A lot of parents, you heard this back in the day, used to give Benadryl to their babies to get them to sleep. What about that?
So Benadryl is not considered a safe sleep aid for children under age 12. That age limit is in place due to safety concerns. No matter how old your child is, you should always contact your provider for guidance on whether it's safe for your child to use Benadryl for sleep. Interestingly, children are more likely to have the opposite effect when taking Benadryl for sleep. This means Benadryl may not relax them. Instead, it can stimulate them. This can cause them to feel more alert, nervous, or agitated, all of which can lead to trouble sleeping as well.
Yeah, all of which the parent does not want in the end. Okay, let's talk about people who work night shifts or have irregular schedules. And so what are the recommendations that you might have to help maintain a consistent sleep schedule for them when they're working odd hours?
So the main forms of treatment for shift workers include changes to your work routine and schedule if possible. I always advise people if there's a way to work day shift, that's the best. It's hard on our body. We're not nocturnal creatures. Changes to your sleep routine at home, like having your spouse help you pick up the children so you don't have to set your alarm and you're only sleeping 4 hours a night. A day. I see that quite often. Bright light therapy is something that can be used for shift workers, and that means exposing yourself to bright light upon awakening. Melatonin can also be used for shift work, and that can be taken 1 to 2 hours prior to bedtime after they've reached home. And if all else fails, sleep medications can be used to help fall asleep on an as-needed basis.
Okay, we've got a little bit over a minute. At what point should someone consider seeing a sleep specialist or having a sleep study?
Well, if the sleep disruption is affecting your quality of life, you're too sleepy during the day, having trouble concentrating at school or work, having mood issues, I would definitely recommend getting a sleep consultation to find out if you're a candidate for a sleep study.
Okay, and that is something that you start with your primary doctor and go from there?
You could either ask your primary care doctor for referral, or you can contact your local sleep clinic and schedule an appointment.
All right, so your last piece of advice you want us to remember about getting a good night's rest.
Tanya, my key to a good night's sleep is to maintain a healthy and consistent bedtime routine. Sleep is vital to our health. I want to reiterate the importance of prioritizing and protecting your sleep to make sure you're getting your 7 to 8 hours per night.
7 to 8 hours. That is the goal, friends. All right, let's try and do that. Thank you so much, Dr. Reddy. We appreciate that. If you missed any of this, this is going to be in the To Your Wellbeing section of our website.